Hello, everyone. My name is Brittany Carell. I'm a student at Stanbridge University for their BSN program. And today I wanted to talk about the significant issue of pressure injuries among hospitalized patients and strategies we can do to implement and reduce the prevalence in evidence-based nursing care. To begin, let's define what pressure injuries are. These injuries are localized damage to the skin and underlying tissues caused by prolonged pressure, usually often exacerbated by friction and shear. Current statistics indicate that around 12% of hospitalized patients globally are affected by pressure injuries every year, and an increasing rate even higher of 14.3% among critically ill patients in the United States alone. Increased risk factors for these patients include immobility, of course, patients that are maybe paraplegic or in prolonged hospital stays have an increased risk of pressure injuries, medical devices, and of course, we have patients with diabetes that have an increased risk of pressure injuries due to diabetic neuropathy. They may not be able to feel these pressure injuries in areas such as the heels of their feet, and this can indicate increased risk for wound infection. Also, vasopressors. Vasopressors are an increased risk due to the fact that they alter tissue perfusion, potentially leading to hypoxia and impaired healing in areas of pressure, such as the bonier prominences. The significance of pressure injuries really cannot be overstated. They not only lead to considerable pain for these patients, but also extend hospital stays and increase overall costs of healthcare. As we can see here in this diagram, about 9.1 billion pressure injury costs in the U.S. healthcare system alone, upwards of 1.1 billion per year. That's a lot. Also, if we see cost per injury, the cost per injury can range from about 20,000 to 151,000. And this is an increasing prevalence in these injuries seen worldwide and, of course, in the U.S. alone. Furthermore, more vulnerable populations, such as the elderly, are at increased risk of these conditions. These injuries can impede recovery and lead to a further decline in their further health status. And here on this slide, we see the stages of a pressure ulcer and what can happen if they are not properly assessed early and taken care of in time. So stage 1, this is the most preventable stage. Of course, we see some redness, non-blanching erythema. The epidermis is intact, so they may have some redness or pinkness, like a little spot in that area we can notice. So we would want to implement some nursing care there, such as maybe applying barrier cream, a bandage over that area so that it's not continually rubbed in friction and shear, because then we can see what happens here in stage 2, the partial thickness ulcer. This involves both the epidermis and the dermis. We can see here some redness, inflammation. We can even see some granule type patterns around this area. This, of course, we would have our wound care nurse specialized into further assessment and taking care of this wound. And of course, stage 3, we see the full thickness ulcer extending through the dermis and now the subcutaneous tissue. Wound vac care would probably be implemented here. We don't know exactly what the case is with this patient, but of course, we can imagine maybe they weren't implemented in being turned routinely. Maybe they were paraplegic and spent a lot of time and pressure on that area. Really, the possibilities are endless as to why these happen. Sometimes even something as small as leaving a cap or a small wrapper or anything in the bed while performing patient care can cause these pressure injuries. So it's important to make sure when we're doing our assessment and implementing nursing care that we don't leave anything in the bed that we brought with us. Stage 4, as we see here, this is very deep tissue destruction extending through the fascia and may involve muscle, bone, and tendons. This will definitely implement wound care, and of course, maybe a physician might be performing these dressing changes in this wound care as well. So the doctor or maybe even plastic surgeon themselves may be performing this type of care. Research reveals that the prevalence of pressure injuries is alarmingly high, especially in healthcare settings such as orthopedic surgery wards, as we see here, around 18.5% prevalence of these injuries. Of course, we are seeing risk factors including limited mobility, low physical activity. Maybe they're paraplegic, maybe they are bedridden, but some way they have a limited mobility. Of course, malnutrition. They may not be getting sufficient amount of vitamin C or proteins. What are their cultural preferences? What are their dietary preferences? Of course, urinary incontinence and advanced age are also increased risk factors for pressure injuries. It's clear that the significant gaps in existing prevention strategies, which necessitates in the development of improvement guidelines. Personalized interventions tailored to specific needs and high-risk patients, of course, should be a part of the standard of care for these patients. In light of these issues, my project focuses on the enhancement of prevention and management strategies for pressure injuries in the nursing care. The key research question guiding this proposal is what evidence-based strategies can we implement to reduce pressure injuries in hospitalized patients effectively? The primary objective of this project is to reduce the incidence of pressure injuries among hospitalized patients. Hopefully by 25% within the next 6 months would be my attainable goal. Proposing several key strategies, of course, to achieve this. First, regular patient assessments, conducting these assessments regularly and catching these pressure injuries, especially over areas such as the heels, elbows, maybe even the sacrum. Of course, we see a lot of those. Regular assessments of these areas and the patients themselves would help greatly in catching these early. Also, as well as implementing regular turn schedules. So repositioning the patient in bed, helping them with, say, trapeze bars for patients that may be paraplegic so that they can shift and move themselves in the bed while also promoting, their own implement of care. Of course, secondly, we would implement individualized risk assessments based on the patient's mobility, as we were talking about. And then nutritional status, as we talked about, protein, vitamin C. Are they vegan? What kind of protein options can we offer for someone who's vegan? Or other cultural practices that they may not be able to get sufficient amount of protein. What's their social economic status? Are they not able to utilize these sources of healthier food options? So of course, then we would implement maybe a social worker. And finally, we aim to provide a comprehensive education and training for our nursing staff. So maybe helping promote them and getting them involved in a specialty like wound care. These offer best practices for preventing and managing these injuries. And preventing them is really the overall goal, is preventing them from advancing to stage 2, stage 3, especially stage 4. In conclusion, it is important that we employ these nursing care strategies in order to prevent pressure injuries in our clients in both acute and long-term healthcare settings. By using these implementations, we can not only decrease the healthcare cost risk, but we could also decrease the prevalence of pressure injuries occurring and worsening. My final thoughts, of course, by prioritizing prevention and effective management of pressure injuries, such as regular assessments, turning the patient every 2 hours, ensuring the skin is warm, intact, and of course, nutrition status as well, we can significantly improve patient outcomes and the overall quality of their care. Therefore, this decreases the prevalence of pressure injuries in the healthcare setting, lowering high-cost treatment measures, and increases the prevalence of better patient care outcomes. I want to thank you for your time in watching my presentation on nursing implementations to prevent pressure injuries. My name is Brittany Perel. I am a nursing student here at Stanford University in evidence-based practice nursing. If you have any other further questions, I look forward to hearing those from you. Thank you for your time.